The Palestinian Red Crescent says autopsies of 15 medics and rescuers killed in Gaza suggest they were shot by Israeli forces with, quote, intent to kill. As the conflict continues, an international team of doctors is trying to support Gaza's remaining health workers by providing telehealth services from around the world. And one of those doctors is a New Zealand registered GP, who, as well as working for her community in Waikato, has been trying to support people in Gaza. And we should warn you, this story has some disturbing pictures. From Waikato to a war zone, the contrast is surreal. But although her family's built a life in New Zealand, Dr. Ruba Hafel is always thinking of Gaza.
As you would know, with the ongoing Israeli airstrikes, 90% of the constructions have been destroyed, and that includes the infrastructure, the hospitals, houses, medical centers. So it is not easy for the patients to reach out and ask for medical advice or ask for medications with the ongoing genocide.
It's 18 months since Hamas launched the October 7th attack in Israel, in which the terrorist group killed more than 1,000 people and took hundreds hostage. In the time since, tens of thousands of people, including thousands of children, have died in Gaza as Israel has sought to destroy Hamas. Israel disputes the characterisation of the war as a genocide, and both Israeli and Hamas leaders have been charged with war crimes by the International Criminal Court. Through it all, as the fighting has continued, Dr. Ruba Hafel has volunteered through a telehealth service to try and help her fellow Palestinians with primary care.
For them to reach out and ask for medical advice does not become a priority. For them to live and make it to the next day is a priority rather. There is another challenge here. When you contact the patient, when they made the request, maybe they had electricity or internet. When you contact them, they might not have the access or this luxury anymore. Maybe they are being displaced and moving from one place to another. Or maybe they're too far to go to the area where they can have access to the internet, so they can't actually reply to your message. Or maybe they got killed.
Using messaging apps, social media and international phone calls, Ruba Hafel is one of approximately 200 doctors working for the Gaza Health telehealth service. Together, they say they've consulted more than 5,000 patients living through the war.
First, let's talk about the air pollution. Because of the 90% destruction of the structures or constructions in Gaza, the air is so polluted, and that means we will end up seeing patients with inhalation pneumonia, inhalation pneumonitis, severe asthma flare-up that we don't normally see in a normal situation. In terms of infectious diseases, that is like it's a disaster. It's a complete different story. Gazans are currently living in tents. So they are living on dump sites, and they're living on sewage sites. They're basically living between the rubbish and the sewage. And you would imagine how unhygienic this is, and the health conditions, the infectious diseases that they would end up with. I've seen a family of 10, mother, father, and 8 children. They all had hepatitis A. Because of the hygienic conditions in Gaza. So we managed to provide them with a little bit of electrolytes through our on-ground team, a little bit of clean water. But their 4-year-old child was severely dehydrated that we couldn't actually ask them to treat him at home. We told them to get him to the hospital. And the next day, I checked on them, and they said, no, we can't go to the hospital. There are lots of airstrikes, and it's not safe. And then I've lost contact with them after that. So I'm not actually sure whether that 4-year-old boy is still alive or not.
If communication is difficult, actually accessing medications in Gaza can be even harder. Last year, the UN Humanitarian Coordinator for Palestine criticised Israel for blocking the delivery of insulin into Gaza. Ruba told us she had a 21-year-old patient with type 1 diabetes who couldn't access the medication and died.
There is a new term in Gaza called wounded child with no surviving family. It's a new term in Gaza. When they receive children in the emergency departments with no any other families with them, for these children to having to face this and seeing their family, brothers and sisters and grandparents or parents are getting killed in front of them, that is a psychological trauma that would live with them forever. So it's not now that we're dealing with the mental health problems. It's like we're talking about decades of dealing with these mental health issues because of what these children and women have to see or to face during the war.
After 18 months of death and despair, the future of the Gaza conflict is no clearer. Dr. Ruba Hafael is determined to continue helping until the war ends.
I don't do what I'm doing in this as part of this telehealth service because I'm a Palestinian. I do it because I'm a human. I'm not doing it because I'm a doctor. I'm doing it because I'm a human. When we graduated and we made the oath that we're going to protect and take care of all the patients and all humanity, regardless of their religion, their race and color, this is our job, to take care and help our colleagues in Gaza and serve the patients in Gaza. If we don't do that, if we don't appall of what's happening in Gaza, if we don't enrage what's happening in Gaza, I think we should put our stethoscopes down and retract the oath that we made when we graduated.